Thank you, sir, for the introduction, and I thank Dr. Alexander, Dr. J. Agarwal, and Dr. Alu for giving me this opportunity. Challenges faced by hospitals in getting entry-level pre-accreditation. This is the perspective of a hospital owner, a small segment hospitals, what we come across. So this starts with my journey. I just will give my experience and then the thoughts of other hospitals in my range who think the same way. In 2012, when I started my new hospital, a 100-bed hospital, I called a consultant to give opinion about whether I could get an accreditation at all. So he came intensively, checked everything, and he told, you are not fit to go for an accreditation because of the infrastructure and various things. Then there are a lot of visitors, doctors all around India coming for training to my hospital. So they, seeing my infrastructure and the processes, they told, why not go for an NABH? So I told, I've been told that I cannot go for NABH, so I'm unfit to be a hospital which can go for NABH. That is the time when in 2014, with the collaboration of NABH, the Tamil Nadu state government had arranged for a sensitization program on entry-level standards. When the entry-level standards were discussed, I felt that I can go for entry-level, and nearly more than 75% of the standards were already present in my hospital. So I took up this challenge and then started working on it, but there was no one to clarify my doubts. And implementation, I tried my level best and did it with poor knowledge. And first entry-level hospital certified in India was my hospital in 2015, and this was with great difficulty and without any knowledge of these standards. My interpretation was different and the assessor's interpretation was different. So I struggled a lot. And then what happened after that? There was difficulty in sustaining these standards. I somehow tried and implemented, but maintaining the standard was a great challenge because we didn't know why it was done and did not achieve any benefit due to certification. I was told that NABH will give good quality and things like that, but without knowing the exact intent of the standards, we were just implemented, and sustaining was a problem and we could not get the real benefit. So I thought, okay, full NABH may give the quality, and I was apprehensive whether I'll get it or not, but still I'll follow the standards for the quality purpose. Then in 2016, since I am a single-owned doctor of the hospital, I didn't have time and I didn't have knowledge of the full standards. So I went for a full accreditation with the help of a consultant, appointed a good quality team, a motivated staffs, but 1 year of intensive training with a lot of money and efforts, we could not achieve the real quality. And then I asked a lot of questions, doubts and unanswered questions to the consultants. The suggestion was, let the NABH team come and raise NCs. We will close it. So that was the answer given, and I was not happy about that because going knowingly that we are not up to the mark was not convincing me. So I thought I have to educate myself, and I attended almost all the training programs conducted by NABH, POI, internal auditor, clinical auditing, documentation, HIC, and everything I attended. And then came the clarity of these standards. Okay, what the standards say, that much was clear, but how to go about was not clear. How to implement. These are fine, but how to implement the standards. So that was a great thing which I could not get through these trainings. And that's the time when the game changer came, the Certified Personnel for Quality Implementation by CAHO. So after attending that, I was still more clear about the intent with the 3 days of extensive brainstorming and each and every elements and the way how to implement, how to form a team, who should be in the team and how to form the committees had given me a clear picture of how to implement, because this program was mainly for us to help other hospitals to implement. So these things were taught, and immediately coming back from the training, I revamped the entire implementation process, conducted training programs explaining the intent of each standards. My staffs easily adapted as they now knew the reason for doing the work and easily sustainable. Completed a final assessment for full NABH recently, and then came the Center for Quality Promotion awarded to me as the first hospital in India by CAHO, and hospitals started approaching me because in my vicinity there are not many hospitals who are NABH even certified or pre-accredited. And the reliability, because now that I have done it with a single ownership and not many, because always the apprehension is only corporates or big hospitals can go for NABH. Small hospitals need a big team, which will be a very costly affair. But seeing me, a lot of hospitals in the same segment approached me, and I started helping them. I could help them 7 hospitals to get NABH even before I could get the CQP logo, and now hand-holding 10 hospitals under CQP in training. With this background, I would like to emphasize the points where the entry into a NABH program for these hospitals, where the fear factors. The major fear factors were the cost. This was mainly because of the poor knowledge of the standards and misleading by a lot of consultants, even the equipment vendors. You name one vendor, he'll come and say, so this is what NABH wants. This is what NABH wants. You ask for a modular theatre, you want to revamp your theatre, they'll say NABH wants a modular theatre. So this is misled and misguided by the various people, and this is what is creating a stop for every hospital to enter into this program. When an entry-level hospital called me and asked, I want to go for this, then I told, fine, I'll help you, what is the problem? He told, no, that hospital has gone for entry-level and they have got entry-level also, but they have spent 1 crore on their infrastructure. Is it true? And I told, not at all. Entry-level doesn't ask so much, and the problem is infrastructure cost, licenses, qualified staff. So these are the main apprehensions for anybody to go into an entry level. Even though it's not true, but that is the inhibiting factor for any hospital to go into this program. Again, infrastructure, modular theatre is one thing which is mistold to the hospitals. A separate entrance for emergency department, dirty corridor in OT, separate entry for patient in OT and CSST. So these all things are being done in several entry-level hospitals already. Nothing wrong in doing it, but that is stopping other hospitals in coming into this scenario. And licenses, most of the licenses are already there with most of the hospitals, but there are few licenses which are impossible in several scenarios, like building approval. Old buildings cannot alter, and new buildings because of space constraint. And fire NOC, everybody can get a fire NOC without any problem, but always with a condition. And lift and genset again is a problem. So documentation is again a big problem for the challenge for the hospitals. They have to spend a lot of time in training the staffs and consultants, and the fear of attrition due to the more documentation. If you start asking your staffs to do a documentation process, the staffs might leave. That is one fear of thing. And elaborate concern taking, the people and the doctors think that they may lose the patient if you come out with a very transparent concern taking form. And poor package rates, not in every state, but particularly in Tamil Nadu and several other states where the government schemes are giving a very poor package. 95% of the patients are under a scheme in 2-tier and 3-tier cities. When we ask these hospitals to go for the NABH, they say, we are already bleeding with the poor package rates and most of our patients are under the scheme, and how are we going to cope up with the quality? Because quality needs a little bit of cost involved. So the hospitals are again, this is again a major problem. And to summarize, the challenges revolve around these major 2 problems. That is the poor knowledge about NABH standards, misleading by the self-trained consultants and equipment dealers. Technology has helped me a lot in bringing in these standards. When I initially applied the technology, when I was thinking that I was about 90% compliant, but the technology proved that it was only 45%. Then I worked on the places where I was weak, and within 3 months I could reach 100%. So technology was one more thing which really helped us in improving our thing. And poor package rates, of course, the government insurance scheme. I request IRDA should take care of these things, package rates, standardize this package rates, so that is not an inhibiting factor. Of course, CAHO is doing a very big role in particularly handling the first 2 points, the poor knowledge about NABH standards and misconception about these standards. Thank you.
Thank you.